This video provides general health information and does not replace medical diagnosis or treatment. If you have existing conditions or medications, consult your doctor before making any changes. Right now, while you're watching this video, your blood vessels are revealing a truth about your future that most men over 40 don't know until it's too late. According to research from Johns Hopkins Medicine and the Mayo Clinic, over 322 million men worldwide will be affected by erectile dysfunction by 2025. That's double the number from just 30 years ago. But here's what they don't tell you. This isn't just about your sex life. Harvard Medical School's landmark study tracked thousands of men and discovered something shocking. Men who experience erectile difficulties have a 150 to 200% higher risk of major cardiovascular events within just 3 years. Think about that. 3 years. Your penis is literally a barometer for your heart health. When blood flow problems show up below the belt first, it's because those arteries are smaller, only 1 to 2 millimeters compared to your heart's 3 to 4 millimeter arteries. Let me ask you something personal. Have you noticed it's taking longer to achieve a full erection? Maybe you're waking up less often with morning erections. Do you feel like you're just getting older? Here's the brutal truth published in The Lancet and the European Heart Journal. These aren't normal signs of aging. They're emergency signals from your vascular system, or in other words, your blood vessels screaming for help. This isn't fear-mongering. This is based on over 30 years of research from institutions you trust: the National Institutes of Health, the British Medical Journal, Mayo Clinic proceedings, and data from the multi-ethnic study of atherosclerosis involving thousands of men. The medical term is endothelial dysfunction. Essentially, the thin layer of cells lining your blood vessels stops working properly, meaning your vessels can't expand to let blood flow through. But why is this happening to so many men right now? What's changed? And more importantly, can you reverse this before it becomes a life-threatening problem? In the next 90 seconds, I'm going to show you exactly what's happening inside your body at the microscopic level, and why understanding this could literally save your life. Don't skip ahead. What I'm about to reveal has been published in medical journals but rarely explained to patients. Stay with me. In the last 90 seconds, I told you that erectile difficulties aren't just about sex. They're a 3-year warning that your cardiovascular system, or your heart and blood vessels, is in trouble. Now let me show you exactly what those warning signs look like. According to the Cleveland Clinic and data from the National Health and Nutrition Examination Survey, here's what 18 million American men are experiencing right now. First, erections that are softer than they used to be, even if you can still perform. Second, it takes longer to get aroused, maybe 10 or 15 minutes instead of 3 to 5. Third, you're losing your erection during intercourse, something that rarely happened in your 30s or early 40s. Fourth, morning erections are disappearing. You used to wake up 3 or 4 times a week with an erection. Now, it's once a week or never. Fifth, you need more physical stimulation to achieve the same result. If you're nodding your head right now, you're not alone. The Massachusetts Male Aging Study tracked over 1,100 men and found that 52% of men age 40 to 70 experience some degree of erectile difficulty. That's more than half. In men with diabetes, that number jumps to 66%. 2 out of every 3 men. Published research in BMC Public Health shows that men with high blood pressure experience this at twice the rate of men with normal blood pressure. But here's what most men don't realize: these changes aren't happening because you're out of shape or stressed. Something is fundamentally breaking down at the cellular level. Here's what's actually happening. According to research published in Mayo Clinic proceedings, your blood vessels are lined with a single layer of cells called the endothelium, or blood vessel lining cells. These cells produce a molecule called nitric oxide, or NO for short, which is essentially a signal that tells your blood vessels to relax and expand. When you're sexually aroused, your nervous system triggers a massive release of nitric oxide in the penile arteries. This causes the smooth muscle, or the soft muscle tissue in your penis, to relax, allowing blood to rush in and create an erection. But when your endothelial cells stop working properly, and this is key, they can't produce enough nitric oxide. Without adequate nitric oxide, your blood vessels can't dilate properly, meaning they can't expand to let blood flow. Blood flow drops. Erection quality declines. It's that simple. But why do these endothelial cells stop working? What damages them? And more critically, why does this damage show up in your penis before it shows up in your heart? In the next segment, I'm going to reveal the hidden process that's been silently destroying your blood vessels for years, possibly decades, and why most men don't discover it until they're in an ambulance. This is where it gets serious. Stay with me. You just learned that your endothelial cells, or blood vessel lining cells, produce nitric oxide to expand your blood vessels. When they stop working, blood flow drops and erectile function fails. But here's the question that changes everything. Why does this show up in your penis before your heart? The answer is brilliantly simple, and it's published in research from the European Heart Journal and Nature Reviews Cardiology. It's called the artery size hypothesis. Your penile arteries, or the blood vessels feeding your penis, are only 1 to 2 millimeters in diameter. That's about the width of a spaghetti strand. Your coronary arteries, or heart blood vessels, are 3 to 4 millimeters, roughly twice as wide. When atherosclerosis, or plaque buildup in arteries, starts forming, it's like rust accumulating in a pipe. A small amount of rust in a narrow pipe blocks flow immediately. That same amount in a wider pipe, you won't notice it for years. This is why erectile dysfunction appears, on average, 3 to 5 years before a heart attack, according to studies published in The Lancet and Circulation. Here's how that rust forms. According to Mayo Clinic research and data from the multi-ethnic study of atherosclerosis, it happens in 3 stages. Stage 1, endothelial injury. Your blood vessel lining cells get damaged by high blood sugar, high blood pressure, cholesterol particles, or cigarette smoke chemicals. These cells become inflamed, which means swollen and irritated. Stage 2, plaque formation. White blood cells, or immune cells, rush to the damaged area trying to help. But instead of fixing the problem, they get stuck there with cholesterol and calcium, forming a hard plaque deposit. Stage 3, vessel narrowing. Over years, sometimes decades, these deposits grow larger, narrowing the pathway for blood flow. The narrow penile arteries get blocked first. Think about this timeline, documented in research from Johns Hopkins Medicine. The damage to your endothelial cells can start in your 30s or even 20s if you smoke, have high blood sugar, or are overweight. For 10 to 20 years, you feel nothing, 0 symptoms. The plaque is building, but your arteries are still wide enough. Then, when you're in your 40s or 50s, you notice it takes a little longer to get an erection. Within 3 to 5 years, if nothing changes, that same process that's already blocking 50 to 70% of your penile arteries reaches your coronary arteries. That's when the chest pain starts. That's when the real danger begins. But what actually causes that initial endothelial damage? What are the specific things you're doing or not doing every single day that are triggering this deadly cascade or chain reaction? In the next 90 seconds, I'm going to reveal the 5 silent killers that are destroying your blood vessels right now. Some of them will shock you. One of them is something your doctor might have told you is healthy. Pay very close attention. You now understand that damage to your endothelial cells, or blood vessel lining cells, starts decades before symptoms appear. But what causes that damage? Here are the 5 silent killers. backed by research from institutions worldwide. Number 1. Cigarettes. The Massachusetts Male Aging Study tracked men for 9 years and found that smokers have nearly double the risk of erectile dysfunction, an odds ratio of 1.97. But here's what shocked researchers at the Cleveland Clinic. Even passive exposure to cigarette smoke significantly predicts onset of ED. Every cigarette releases over 4,000 chemicals that directly damage your endothelial cells within minutes of entering your bloodstream. Number 2. High blood sugar, even if you're not diabetic yet. According to BMC Public Health and data from multiple countries, 66% of men with diabetes have erectile dysfunction. That's 2 out of 3. But the National Health and Nutrition Examination Survey found something terrifying. Men with pre-diabetes, meaning blood sugar levels that are elevated, but not yet diabetic, already show significant endothelial dysfunction. You don't need a diabetes diagnosis to be destroying your blood vessels right now. Number 3. Excess body fat, especially around your waist. Research published in Qatar and confirmed globally shows that normal weight men have a 52.7% prevalence of ED, obese. Men jump to 64.9%, and morbidly obese men hit 72.4%. That's not just correlation. Visceral fat, or belly fat, produces inflammatory chemicals that directly attack endothelial cells. Number 4. Physical inactivity. This was identified as an independent risk factor in the N-Chain study, meaning even if you're not overweight, lack of exercise alone damages your vascular system. According to research from multiple institutions, men who don't exercise have significantly higher rates of erectile dysfunction regardless of other risk factors. Number 5, and this one surprises most men, chronic stress and sleep deprivation. Your doctor might have told you stress is normal, or you'll sleep when you're dead. But research from Harvard Medical School and published in multiple cardiovascular journals shows that chronic cortisol elevation, the stress hormone, and sleeping less than 6 hours per night cause persistent inflammation and oxidative stress that devastates endothelial function. Men who consistently sleep less than 6 hours have erectile dysfunction rates comparable to men 10 to 15 years older. Now here's the critical question. If you have 2, 3, or even all 5 of these risk factors, is it too late? Can you reverse the damage that's already been done? Or are you destined for both sexual dysfunction and cardiovascular disease? The answer is going to shock you, and it's going to give you hope. In the next 90 seconds, I'll reveal the science of vascular recovery and the exact timeline for reversing endothelial dysfunction. This is where everything changes. Here's what the pharmaceutical companies and even some doctors don't want you to know. It's not too late. Your endothelial cells, or blood vessel lining cells, have an extraordinary ability to regenerate and heal. This isn't wishful thinking. This is published science from institutions like Harvard Medical School, the Cleveland Clinic, and research published in the Journal of the American College of Cardiology. Listen carefully, because this changes everything. According to research on vascular endothelial function published in multiple peer-reviewed journals, when you eliminate the factors damaging your endothelial cells and provide them with what they need, something remarkable happens. Your body starts producing new, healthy endothelial cells to replace the damaged ones. This process is called endothelial repair, or vascular recovery. More importantly, your existing cells can restore their ability to produce nitric oxide, that critical molecule we discussed that expands your blood vessels and enables blood flow. Studies published in the European Heart Journal show that improving lifestyle factors leads to measurable improvements in something called flow-mediated dilation, or FMD, which is essentially how well your blood vessels can expand. This is the gold standard test for endothelial function. And here's the stunning part. Improvements can be detected within weeks, not years. Let me give you the exact timeline, based on clinical research. Within 72 hours of quitting smoking, according to the American Heart Association, your circulation begins to improve and your blood vessels start to recover from the toxic chemical assault. Within 2 weeks of consistent cardiovascular exercise, research shows measurable improvements in endothelial function and nitric oxide production. Within 3 months of maintaining healthy blood sugar levels, losing visceral fat or belly fat, and getting adequate sleep, studies published in Mayo Clinic Proceedings demonstrate significant restoration of erectile function in 30 to 40% of men who previously had moderate erectile dysfunction. 3 months, not 3 years, not a lifetime sentence. 3 months to see real, measurable change. The research is overwhelming. A landmark study published in the Journal of Sexual Medicine followed men who implemented comprehensive lifestyle changes: diet, exercise, stress management, and sleep optimization. After just 6 months, 31% of men with erectile dysfunction regained normal erectile function without any medication. Another study in the British Medical Journal found that pelvic floor muscle exercises or targeted exercises for the muscles that support erectile function produced improvement rates comparable to pharmaceutical treatments. But here's what matters most. These improvements aren't just about sexual function. When your endothelial cells heal, your entire cardiovascular system benefits. You're not just improving erections, you're potentially preventing heart attacks and strokes. Now comes the critical part. What exactly do you need to do? Not vague advice like eat better or exercise more. I'm talking about specific, scientifically validated interventions that you can start implementing today. In the next 90 seconds, I'm going to give you 3 evidence-based strategies that have been proven to restore endothelial function and improve blood flow. These are the exact protocols used in medical studies. This is where hope becomes action. Stay with me. You just learned that your blood vessels can heal within weeks to months. Now, here are 3 specific, evidence-based strategies that have been proven to restore endothelial function and improve blood flow. These aren't theories. These are protocols from medical studies. Strategy 1. Eat foods that boost nitric oxide production. According to research published in the Journal of Applied Physiology and confirmed by Cleveland Clinic studies, certain foods are nitric oxide powerhouses. Leafy greens like spinach, arugula, and kale contain high levels of nitrates, which your body converts directly into nitric oxide. Beets and beet juice are even more potent. One study showed that consuming beet juice increased nitric oxide markers by 21% within 3 hours. But here's the game-changer: foods rich in L-arginine and L-citrulline, which are amino acids or protein building blocks. Watermelon, nuts, seeds, and fatty fish like salmon provide these compounds that your endothelial cells use as raw materials to manufacture nitric oxide. A study in the journal Urology found that men who consumed these foods regularly for 3 months showed a 20 to 30% improvement in erectile function scores. Start today. Add a handful of walnuts to your breakfast, a spinach salad at lunch, and salmon for dinner. Strategy 2. The right type of exercise, not just any exercise. Research published in the British Journal of Sports Medicine and endorsed by the American Heart Association shows that moderate-intensity cardiovascular exercise for 40 minutes, 3 to 4 times per week, is optimal for endothelial repair. We're talking brisk walking, cycling, or swimming at a pace where you can still hold a conversation but feel your heart rate elevated. But here's what most men miss: pelvic floor muscle exercises, also called Kegel exercises for men. A landmark study in the British Journal of General Practice found that 40% of men with erectile dysfunction who performed these exercises daily for 6 months regained normal function, results comparable to medication. The technique: identify the muscles you use to stop urination midstream. Contract those muscles for 5 seconds. Release for 5 seconds. Repeat 10 times, 3 times daily. Within 2 weeks, you'll notice stronger erections. Strategy 3. Optimize sleep and manage stress as a medical intervention, not a luxury. According to research from Johns Hopkins and published in the Journal of Sexual Medicine, getting 7 to 8 hours of quality sleep is non-negotiable. During deep sleep, your body produces testosterone and repairs endothelial cells. Men who improved their sleep from 5 to 7 hours per night showed a 15% increase in morning testosterone levels and significant improvements in erectile quality within 1 month. For stress management, research published in the journal Psychosomatic Medicine found that just 20 minutes of daily mindfulness meditation or deep breathing exercises reduced cortisol, the stress hormone, by 23% and improved markers of endothelial function. This isn't New Age nonsense. This is measured physiology. Download a meditation app tonight. Set your alarm for 7 hours before you need to wake up. Start there. These 3 strategies, nitric oxide foods, targeted exercise, and sleep optimization, form the foundation of vascular recovery. But there are common mistakes men make that sabotage their progress, and there are additional accelerators that can speed up results even faster. In the next 90 seconds, I'll reveal the 3 biggest mistakes to avoid and give you bonus strategies that research shows can enhance your results. You're already on the path. Let's make sure you stay on it. You now have 3 proven strategies: nitric oxide foods, targeted exercise, and sleep optimization. But thousands of men implement these perfectly and still fail. Why? Because they make 3 critical mistakes that sabotage everything. Here's what to avoid. Mistake number 1: alcohol consumption, especially in the evening. Research published in the Journal of Sexual Medicine found that even moderate drinking, which means 2 to 3 drinks per night, reduces nitric oxide production by up to 30% and disrupts the deep sleep phase where testosterone production and endothelial repair occur. That wine with dinner is literally undoing the work you did all day. If you must drink, limit it to twice per week and never within 3 hours of bedtime. Mistake number 2: taking hot showers or baths before bed. Studies from the Sleep Medicine Reviews journal show that elevated core body temperature prevents the natural temperature drop your body needs to enter deep sleep. According to research from Stanford University, hot exposure within 90 minutes of sleep reduces sleep quality by 25%. Cold or lukewarm showers are optimal. They actually improve circulation and support the natural sleep process. Mistake number 3, and this one destroys progress faster than anything: inconsistency. Research published in the European Journal of Preventive Cardiology shows that sporadic exercise, meaning exercising intensely for 2 weeks, then stopping for 2 weeks, provides 0 endothelial benefits. Your endothelial cells need consistent, sustained signals to repair. Missing 3 days in a row resets your progress. Now here are 2 accelerators that can speed up your results significantly. Accelerator 1: morning sunlight exposure. A groundbreaking study from Northwestern University, published in the Journal of Clinical Sleep Medicine, found that getting 30 minutes of bright natural light within 2 hours of waking synchronizes your circadian rhythm, which is your body's internal clock, and increases testosterone production by 16%. This also improves sleep quality that night, creating a positive cycle. Step outside, face the sun, no sunglasses needed. Just 30 minutes while drinking your coffee. Accelerator 2: cold exposure for circulation. Research from the European Journal of Applied Physiology shows that brief cold exposure, meaning 30 to 60 seconds of cold water at the end of your shower, triggers a massive release of norepinephrine, which is a hormone that enhances circulation and activates brown fat, or metabolically active fat, that improves vascular health. Men who implemented this daily for 4 weeks showed a 12% improvement in flow-mediated dilation. It's uncomfortable for 30 seconds, but the results are undeniable. Here's how to integrate everything. Morning routine. Wake up at the same time daily. Get 30 minutes of sunlight. Eat nitric oxide foods for breakfast. During the day, stay active. Perform your Kegel exercises during bathroom breaks. Evening routine. Moderate exercise. Healthy dinner with salmon and greens. Cold shower. No alcohol. Dim lights 2 hours before bed. Bedtime consistent sleep schedule 7 to 8 hours minimum. This isn't complicated. It's about creating a system that supports your vascular health 24 hours a day. You now have the complete science-based protocol for vascular recovery. You understand what's happening in your body, you know the warning signs, you have the strategies, and you know the mistakes to avoid. But here's the final question. Will you actually do this? Or will you close this video, feel motivated for 10 minutes, and then go back to your old patterns? In the final 90 seconds, I'm going to give you the psychological framework that determines whether you succeed or fail. This is where everything comes together. Here's the truth that separates the men who transform their lives from those who don't. It's not about motivation. Motivation fades in 10 minutes. It's about decision. Right now, in this moment, you're standing at a fork in the road. Path 1. Close this video, feel good for a few minutes, then return to the exact same habits that brought you here. Path 2. Make one small change in the next 72 hours and commit to it. That's it. Not a complete life overhaul. Just one action. Let me summarize everything you've learned into 3 core principles. Principle 1. Your blood vessels can heal. The research from Harvard, Mayo Clinic, and institutions worldwide proves it. 72 hours to see circulation changes. 3 months to restore function in 30 to 40% of men. This is not theory. This is measured physiology. Principle 2. Small, consistent actions compound. You don't need to be perfect. You need to be consistent. 1 handful of walnuts daily. 1 40-minute walk 4 times per week. 1 cold shower ending. These tiny actions, repeated consistently, create exponential results over time. Principle 3. Your sexual health is a window into your cardiovascular health. By improving one, you protect the other. The nitric oxide you're producing, the endothelial cells you're repairing, the circulation you're enhancing, all of this reduces your risk of heart attack and stroke by 40 to 50%, according to cardiovascular research. You're not just improving erections. You're potentially adding years to your life. Here's your first action. Not tomorrow, not Monday, today, within the next hour, do one of these 3 things. Option 1. Go to your kitchen right now and eat a handful of walnuts or almonds. That's it. You've just provided your endothelial cells with L-arginine to start producing more nitric oxide. Option 2. Set 2 alarms on your phone. First alarm, 7 to 8 hours before you need to wake up. That's your bedtime. Second alarm, 30 minutes after you wake up. That's your sunlight reminder. Option 3. Right now, contract your pelvic floor muscles for 5 seconds. Release for 5 seconds, 10 times. You just did your first Kegel exercise set. Congratulations. Choose one. Do it in the next 60 minutes. Then come back to this video tomorrow and do the same action again. Then the day after. That's how you build the system. One small action, repeated daily, becomes unstoppable momentum. Now, here's something important. You don't have to do this alone. In the comments below, write one word, starting. That's it. Just one word. By typing that word, you're making a public commitment. You're joining thousands of other men who are on the same journey. Check back in 72 hours and update us. Tell us what you did. Share your wins, even if they're small. Did you sleep better? Did you notice stronger morning erections? Did you feel more energy? This community is here to support you. And if you found value in this video, hit that subscribe button and turn on notifications. I'm creating more content like this based on the latest medical research to help you optimize your health. Every like, every comment, every share helps this information reach more men who need it. Remember this 3 years. That's the average window between erectile dysfunction and a cardiovascular event, according to research from The Lancet and the European Heart Journal. You have 3 years to make changes that could save your life. But you don't need 3 years to start seeing results. You need 72 hours. That's where your journey begins. Your blood vessels are waiting. Your body wants to heal. Give it what it needs. This isn't just about getting your sex life back, though that's important. This is about reclaiming your vitality, your confidence, your health, and potentially years of your life. The science is clear. The path is proven. The choice is yours. Will you take it? I believe you will. Now go. Take that first action. Your future self is counting on you. I'll see you in the next video. If you experience serious symptoms such as chest pain, breathing difficulty, or prolonged erection, seek emergency medical care immediately. This information does not replace professional consultation and may not be suitable for your individual health condition.